My dear friends, today I need to talk to you about something both serious and deeply personal. A brain condition that steals away not just memory, but personality, emotions, and independence. It's called frontotemporal dementia, or FTD. Many of you may have heard the term, especially with recent headlines about public figures battling this cruel disease. But very few people truly understand what it means and how it can slowly take away a person's identity before they even realize what's happening. Before we dive in, please take a moment to subscribe to CureCloud. I promise you, the information we share here could protect your health, your mind, and even your family. Hit that subscribe button now, because knowledge is one of the strongest defenses you can have. Frontotemporal dementia is not like Alzheimer's. In fact, it often appears earlier, sometimes in people in their 50s or 60s. Instead of beginning with forgetfulness, it often starts with something far more subtle and sometimes frightening, a change in personality, behavior, or speech. I've seen seniors who once were gentle, kind, and soft-spoken suddenly become irritable, blunt, or even careless with words. Imagine a man who always cherished his wife, suddenly making hurtful comments without realizing it. Or a grandmother who was once very polite, suddenly eating with her hands or saying things that shock her family. These aren't just bad habits. They can be early warning signs of frontotemporal dementia. Now let me tell you how this disease works inside the brain. Your brain is divided into different regions, and the frontal and temporal lobes are like the headquarters for your personality, decision-making, emotions, and language. In FTD, nerve cells in these areas begin to waste away. Proteins like tau or TDP-43 clump together and damage the neurons. As the brain tissue shrinks, the very essence of who you are, the way you speak, the way you feel, the way you relate to loved ones, begins to change. This is why it's so devastating. Unlike memory loss alone, FTD steals the ability to behave normally in society. Patients may become impulsive, overspend money, laugh at inappropriate times, or lose empathy for those they once loved. Some begin eating compulsively, craving sweets all day long. Others struggle to find the right words, their sentences getting shorter and harder to understand. Have you ever noticed a friend or partner who suddenly stops caring about their appearance, wears the same clothes every day, or forgets basic manners at the dinner table? Sometimes these changes are brushed off as just aging or a bad mood, but in reality, they can be the whisper of frontotemporal dementia. And here is the frightening part. In the early stages, many people look perfectly fine on the outside. They can still drive, walk, and go about their daily routines. But slowly, without warning, their ability to manage social behavior, relationships, and language is disappearing. Let's pause for a moment. If you've made it this far, I want to thank you from the bottom of my heart. It tells me you care about your brain health and maybe about protecting someone you love. If this video speaks to you, please take a second to subscribe to CureCloud. By doing so, you're not just helping yourself, you're helping me continue to share these vital messages with other seniors who may be silently struggling. And while you're here, tell me in the comments, do you know someone who showed sudden personality changes before a diagnosis? Type the number 1 if yes, or number 2 if no. Now let's continue. The causes of FTD are still being studied, but genetics can play a role. If a parent or sibling had this condition, the risk is higher. Certain gene mutations are known to trigger the abnormal proteins that damage brain cells. But lifestyle, overall health, and long-term brain stress also contribute. I want you to picture this. One of my patients, a retired teacher, came to me with complaints that her husband was becoming rude and cold. She thought he had simply grown tired or depressed. But when I examined him, I saw signs of frontotemporal dementia. He struggled to put sentences together, and he didn't even realize how much he had changed. For the family, it was heartbreaking, but catching it early meant we could start therapy, adjust his nutrition, and prepare them for what lay ahead. Speaking of nutrition, let me tell you something hopeful. While there is no cure for FTD yet, research shows that diet and brain-friendly nutrients can play a powerful role in protecting neurons and slowing decline. Diets rich in omega-3 fatty acids, like those from salmon, sardines, walnuts, and flax seeds, help reduce brain inflammation. Antioxidants from blueberries, spinach, and kale fight oxidative stress, one of the hidden enemies that damages brain tissue. I recommend seniors eat plenty of leafy greens, colorful vegetables, and foods rich in vitamin E, such as almonds and sunflower seeds. Vitamin B12 and folate, found in fish, beans, and fortified grains, support nerve health and protect against brain shrinkage. And let's not forget hydration. The brain is 75% water, and even mild dehydration can worsen confusion. There's another story I want to share. A widowed woman in her early 70s began showing unusual habits, buying dozens of chocolate bars at once and forgetting why she bought them. Her daughter was worried, so they changed her diet. More fish, berries, green vegetables, and omega-3 supplements. Within weeks, her daughter told me, "Mom is sharper. She still struggles with words, but she's calmer, and her mood is better." Was it a cure? Number. But it showed how powerful nutrition can be in supporting brain function, even in the face of FTD. Now, some of you may wonder, is there treatment beyond diet? Yes. Doctors sometimes prescribe medications to help control symptoms like depression, anxiety, or impulsive behavior. Speech therapy can help with language problems. Occupational therapy helps patients adapt to daily tasks. And exercise, gentle walking, stretching, or dancing, has been proven to support blood flow to the brain and boost mood. But let me be clear. The earlier you recognize the signs, the better the outcome. Waiting too long, ignoring personality changes, or dismissing speech difficulties as normal aging can delay diagnosis, and every month matters. If you're still listening, I want to thank you once more. It takes courage to face such a difficult topic. And if you find this video helpful, please subscribe to CureCloud right now. You'll not only get more science-based guidance, but you'll also help me bring this information to countless other seniors. If you'd like me to make more videos about brain health, type the number 3 in the comments. It will let me know you're interested. Let's close with something practical. If you want a simple, senior-friendly recipe that supports brain health, here's one you can try. Take a piece of salmon, bake it gently with olive oil, lemon juice, and a sprinkle of fresh herbs like parsley. Serve it with a side of steamed spinach and blueberries for dessert. This meal is not only delicious, but it's also packed with omega-3s, antioxidants, and vitamins that your brain craves. My dear friends, frontotemporal dementia is a frightening disease. But awareness is power. By knowing the signs, personality changes, loss of empathy, sudden sweet cravings, or struggles with speech, you can take action early. By eating brain-protective foods, staying hydrated, exercising, and seeking medical care, you give yourself and your loved ones the best possible chance. So before we end, please, hit that subscribe button now. Share this video with a friend who might need it. Because together, we can protect our minds, our independence, and our futures.